Welcome to the Front Room, Fishburn Hedges' regular series of focus groups that take a look at what's happening in real people's lives. In the latest of our series of focus groups for the Front Room, we've taken a look at pharmacists. As a profession, pharmacists are increasingly getting involved in the frontline delivery of healthcare services. But as we've uncovered, the process isn't as straightforward as it should be.
And they're running campaigns like for sexual health and cholesterol testing and diabetes testing, and we feel we're more now, not pharmacists, but more of a kind of first line MOT mechanics.
Well, a lot of people come to me and they ask me, they ask me and my staff for things like smoking cessation, and in the middle of the interview they will say, oh, by the way, I think I've got cancer, or by the way, I've got a problem here, where they should actually be going to the GP. I can understand patients because once they're in the room, they treat me and my staff like a GP.
Another issue is that when big public health campaigns are happening, pharmacists aren't getting the advance notice they need to be geared up and ready to deliver the services required.
It was pretty much a DIY kit, just do it yourself, read, and no sort of explanation, no one to ask questions, feedbacks or anything. Just do it yourself and go.
There has to be clear guidelines on that. I mean, in particularly for legal issues, we don't know their medical history, and it's quite dangerous to make presumptions.
We are doing these tests, but we are just getting a pamphlet from them that do these tests, but we're not really trained. We're not going on a half-day residential course to try out this testing. We might be doing the test, but we don't know what we're testing. I mean, okay, we're doing a cholesterol test, but what should we really be looking for?
In practice, pharmacists don't believe that they're getting the help and training they need to deliver these services.
For big campaigns, instead of just advertising and saying go and see your GP and giving us 1 month's notice, they should come to us first and then advertise. We've had cases where we've seen it advertised and they all come to us and we'll say, well, we're not ready. We don't have a service for you. Really, they're not telling us what they have in their minds. All of a sudden they'll say, oh, we want to do this, we want to do that. Now they've obviously planned it, but we have no knowledge of that planning at all. So we need to know, if they're thinking of providing a new service, which we're quite happy to take on, but they have to consult us.
What I especially feel is that it's a hit and miss. You hear it from the public, they know more about it than we do. I mean, we don't get flyers, we don't get information, we don't get any welcome packs that, oh, we're going to do a new initiative and you should be aware of it, it's coming in 3 months. It just hits us saying you're going to be doing testing. But what testing and why should we be doing it? There's no kind of two-way information flow.
But reaching pharmacists to keep them in the loop is relatively easy. As well as their trade media, it's the normal techniques and channels that are going to apply.
By email, by flyers, by internet, they can do that as well. They've got our email address, they can send it to our head office or to our personal email address. On that sense, we're getting a lot of young teenagers coming in requesting information about sexual health, chlamydia and stuff like that. So I've specifically gone to the PCT and asked for, they can send us some leaflets, especially on certain sexual problems like chlamydia and venereal disease. We even get guys coming in as well now asking us about it. They're more afraid to go to the doctors because they know them, their family history, so they feel that they can be more independent with us and open.